So good morning, everyone. Thank you so much for coming to this discussion. I think that this is a really critical issue for people in our community in particular. This is the district with the #1 ACA enrollees in the country. That's out of 435 districts around the country. This is the place that we need to be most concerned with the fact that our premiums are doubling, they're tripling, and it's all because of the Congresswoman's inaction. So this is my community, she's my representative, and I am compelled to speak out and make sure that we're focusing on people's costs right now, because that's what's critical. So what people are facing, this is their everyday lives. They're having to choose between their medications and their food and their rent, and that shouldn't be happening in the United States of America, the greatest country in the world. These premiums, these Affordable Care Act premiums will double or triple. 213,000 people in this community are going to have to just eat that cost. And they don't even know where they're going to get the money to supplement these insanely surging, skyrocketing costs. But then another 93,000 people will just be priced out of healthcare entirely. That's really scary for them because they're not going to have any healthcare. They're just going to go without it because they can't afford it. And as of course, a matter of human compassion, that's awful. It's also a matter of our pocketbooks, everyone else's as well, because these folks, of course, will still get treatment, and it will mean higher premiums for everybody. So what we need to do is focus on extending these ACA subsidies. The Congresswoman refuses to sign the discharge petition that would demand a vote right now. Right? This is what we need right this second, not putting it off till January, putting it off till February. Folks are struggling right this second. And that discharge petition would force a vote right now, as opposed to having to have our Congresswoman be on the other side of the negotiating table. She needs to represent the people in this community and not, bargain with our healthcare, bargain with our lives, saying, well, maybe another 6 months, well, maybe another year. The reason people are struggling with these high costs is because of this economy and the instability that the president has introduced into it, with a tariff on one day, tariff off one day, American farmers dealing with these tariffs and really being hurt, our immigration policy being so disastrous that it is hollowing out our agricultural sector, our construction sector. We're worried about the price of groceries, the price of our housing, deporting good, tax-paying, hard-working immigrants who have no criminal history is not the way to go about it. And so it's all part of the same problem. And so I wanted to get you guys together because I want to hear about on the ground what this is looking like for people in our community, for patients that you're dealing with, for people a part of your organization that are using those, your care and your help, and whether the funding that the government typically provides for those organizations, whether that's dwindling, whether that's really becoming more of a problem because this administration and the Congresswoman are refusing to help struggling middle-class, working-class families. So I'd love to get started first with the good doctor to my left, Dr. Woolsey. He's a 35-year ER physician at Jackson. If you would, just introduce yourself and tell us a little bit about what you're seeing on the ground in terms of the real struggles that people are facing with healthcare costs.
Thanks a lot, Robin, and thanks for having me. I mean, you're really talking about my patients. And I grew up in South Florida. I trained at Jackson. I've been an emergency physician there, served for 35 plus years. So unfortunately, I'm all too much of an expert on what are the financial, but especially human costs of the policies that we're seeing, especially taking away insurance from people over the next couple of months. The first thing is to really get our head around the fact that going to the emergency room is not getting care. I mean, it's getting your emergency taken care of. And when somebody comes in with an acute stroke or an acute heart attack or kidney failure, it's because their hypertension wasn't controlled, their diabetes wasn't discovered, their kidney insufficiency wasn't discovered. They come in with catastrophes that are unnecessary, and it's heartbreaking to have to play catch up like that with a problem that should have been detected before. And what's even more heartbreaking is we've been through this. We talk about what's it going to look like when people don't have access to their Affordable Care Act subsidies. Before the Affordable Care Act wasn't that long ago, and we saw what it does. We had many, many, many more people than we do now in our emergency department who don't have insurance, who come in because of these complications like I was talking about. The most vivid for me is, more than a few people who would come in with a headache and their blood pressure was 220 over 130. Sorry, doc, I couldn't get my medicine. Please come in next time before you run out of medicine. We're always here for you. But it's a struggle. I mean, to go to the ER just to get pills. So 6 months later, another headache. Eventually coming in with the big bleed and unconscious and with a tube in their throat. And that happens over and over. And for somebody who's supposed to represent us in Washington and fight for what's right for our community, that's really important to know, is that the very least we can expect is a system where people have access to robust primary care so these problems can be discovered, number one, and then comprehensive medical care where the problems can be taken care of before somebody ends up in the emergency room with a catastrophe.
And that's a great point about costs will lower for everyone if we have preventative care on the front end, right? If we're waiting to the back end, that's already...
People get better, live better, and it saves money for everybody.
Good. Let me introduce Martha Baker to my right, nurse, founding nurse manager at Jackson ICU, and president and executive director of SEIU Local, not 1991. If you could tell us about yourself, about your work, and again, also just, paint a picture for us, so that we're not just talking about numbers. I talked about 200,000, 93,000. It's hard to put a human face on that. Can you help us picture it?
Yeah, and this is, thank you for doing this. It's an important, and Dave and I have been working together, and whether it's in our union or in our unit at Jackson, but the richest country on earth should have health care for its citizens. And by the way, that costs less. And this is such a ridiculous argument that people say we can't give health care to our residents, not just citizens, our residents, because it's too expensive. That's just untrue. What we're doing right, without giving health care to everyone, and the Obamacare and the subsidies, we're certainly moving in the right direction. But we know that that's the most expensive way. We put, 80% of our dollars on, 80% of our healthcare dollars are spent on chronic illnesses like Dave described. If we could do prevention and wellness, we would save money and treat human beings the way they should be. And, we are the richest country on earth. We should be leading, not being the only one of the industrialized world who's not doing this for our citizens. And it's a shame because healthcare has become a profit-making industry. We make more money on sick people. We make more money when we give them, the pharmaceuticals make more money when they sell all the drugs that help these chronic illnesses. But when I was managing the trauma ICU, elected officials would come through. We trained the U.S. Army at Jackson, and I always say, Canadian doctors come down and train with us because we have 9 gunshots a day, and Canada has 9 a year. We go to a whole other subject of gun control. But, it's such a privileged place, and electeds would love to come through there. And I used to tell them, we don't know who was the drunk driver, who the drunk driver hit, who was the shooter, or who was the innocent bystander. We just save lives for a living. And we were very proud of a 95% survival rate. But everywhere at Jackson, and they've got a mission that this whole country should copy. A single high standard of care to all residents, not citizens, residents, regardless of your ability to pay. So when you talk about these subsidies going away, and Jimenez, Salazar, and Diaz-Balart should know, that it's going to be our local community that picks up the bill when they go to Jackson. If the federal dollars are stopped, whether they go through the individual and subsidies or however, but when you cut that funding, we won't stop people from coming to Jackson. Sick people won't go away.
Right.
They'll be there and we'll be paying for them. Our property taxes could go up or whatever. They're going to find the money somewhere to pay for that. And Jackson is at risk. And they're about a $3 billion budget a year. They're at risk with these subsidies going away. Going back to, as Dave described, the pre-Obamacare, we were about 20% uninsured at Jackson. With Obamacare, we dropped to 8% uninsured. We are now at risk at Jackson of losing $100 million a year from the subsidies that now Jackson will have to absorb. And we've got a CEO who's telling us they can't afford to give us a cost of living because the wallet's so tight. So $100 million is not just, a nickel. It's significant, and it could, Magoya even said, it could bankrupt Jackson. So I think it's a very serious problem, and I was proud to say, and still am, that Jackson's the way healthcare should be delivered. and that Jackson would be the one who would be a victim of this, and that means the patients they serve. You know, it's just going backwards. We should be using Jackson as a model and go forward. And it's so frustrating that they're playing politics with healthcare. And every elected official, I think, knows this. It's not a secret that only us in healthcare know.
Right.
That, you know, if you do healthcare right, it costs you less. There's not many things in the world that you can do that. You know, I always say, you wanna buy a safer car, you buy a BMW, a Volvo, something to be safe, and it costs you more perhaps. Healthcare's the other way around. If you do it right, it costs you less. You know, you do prevention and wellness, give people access on the front end. It's way cheaper than waiting till these chronic diseases that they see come through the ER every day, and we pay for it then too. So it's frustrating. You know, we had some candidates down and did a press event at our office weeks ago. But you know, the stories that people told, and these are, you know, one gentleman was a clinical psychologist, I'm sure earning a decent wage, but with, you know, 3 kids and a wife who had a chronic illness, cancer, with a child who was autistic. I mean, he was like, my insurance is gonna go from $3,000 a month to $4,500 without the subsidies.
Right.
So it's not just, you know, the working poor is a lot of us, you know,
Yeah, of course.
especially in South Dade. So yeah, I was listening to the radio on the way here, and they were talking about, you know, this topic coming up, and I want to work beside you and help you all we can to make sure that, you know, they vote this December to do the right thing and extend these subsidies, but that's just a piece of setting healthcare straight in this country. And I think it's a win-win when we do it right.
Yeah.
And it's kind of embarrassing that we let people get elected who would rather give breaks to billionaires and still let healthcare cost more. It's
Yeah.
not saving money.
No,
It's saving
right.
the money they're spending there that they can shift into the billionaires. But the people of Dade County will pick up the tab for that.
Absolutely. 2 things that, you know, ring true to me. Number one, that Jackson is an institution in this community, and that's sad. That's sad to think that our policies potentially help leading to bankruptcy, help leading to not being able to give the care that they have been giving to us in our community for so long. Having grown up here, that was, you know, the flagship institution. And then exactly right what you're saying in terms of, it's always a matter of, well, how are you gonna pay for it, right? Well, we just saw the Congresswoman voted to give tax giveaways and tax breaks to corporations and billionaires. So there's always money in the budget for that, because, you know, that's deficit exploding, that's revenue reducing, that costs money to give those tax giveaways to folks who are not struggling right now, where the rest of us, right, working class, middle class folks, which is the majority, overwhelming majority of us, right? This is billionaire with a B in corporations, is where that tax giveaways were heavily weighted. That's where we can actually help give folks the subsidies that they need to be able to afford their health care. So it's all about priorities. The money's there. It's just about, what do you care about? Are you in the pocket of billionaires and corporations like Congresswoman Salazar, our Congresswoman is? Or are you gonna be on the side of everyday Americans who right now, again, are struggling because of this economy? This is not the moment to take away people's health care. It's an exact opposite moment to try to conserve and do it on the backs of middle class, working class people. So thank you so much for that, Martha. Let me turn to Kat Rousseau and Jennifer Resnick, and I'd love to you guys to share about, I know you're both on the board of Patches. Tell us a little bit about what Patches does, and whether right now you're facing any sort of cuts, funding, that is becoming problematic for you to be able to serve your clients.
So I'm not sure that you know what Patches is. Patches is a not-for-profit PPAC, and you would know what that means. But we've evolved into a model of care that, and for you, Robin, we serve children in poverty, and that's a very loose definition, because if you're 1 degree and the bar has been moved up, what requires you to be eligible for Medicaid. But if you're $1 above, you do not qualify. Insurance companies do not pay for this service. And what is the service? It's a medical nursing therapeutic center that bridges the gap for children in poverty who are discharged from places like your PICU, where maybe a single mom and not even a single mom might give birth to a 25-weeker whose prognosis looks awful, and she's 18 years old, and she has no clue what to do with her child on discharge. Those kids come to Patches, and at Patches they receive all their nursing care, all their therapeutic care, education, food, nutrition, because many of them are food challenged families, and they serve these children from birth to 21 where they age out. Now, we had a story not too long ago of a young mom who was 18 years old, who was a scholarship student down south and chose to keep her child, her baby. The baby was born at 24 weeks. He was discharged at age 6 months with a prognosis that he would never walk. They gave her a wheelchair. The child ended up at Patches, luckily, was discharged, which 95% of our kids are, at the age of around 4. Went to then a normal preschool, went to an elementary school down south, started playing football. He walked at 2 with all the therapy that he was getting there, and ultimately landed up at a private school on scholarship with being the head of the football team. Captain of the football team. And from that, he went on to college to play for one of the colleges up north. It's a remarkable success story. On the other hand, we have kids like a current patient, the most gorgeous little boy, we call him Baby Q, whose mom is a teacher. And this speaks to what we're speaking about now, that what does poverty mean? What does having a very ill child mean? It means you can't work. It means you have to give up a salary. It means your child might not be getting the best care. It means you can't afford the care if you're staying home to look after that child. Baby Q is on oxygen. He's on a gastric intravenous line. His mom was a teacher. She came desperately to Patches because she could not afford, insurance wouldn't pay, and she could not afford to keep him at home. Patches now cares for him full-time, 8 a.m. to 6 p.m. or whenever he goes home on his bus. We have 4 buses that transport the kids to the hospital, to Jackson, to Nicholas, to wherever their doctors, their specialists. So we're the bridge between hospital and home, but a superlative bridge, a bridge that has kids coming out in ways that they would never dream of. Where's the problem for Patches? ACA and Medicaid have reduced and denied kids like there's no tomorrow. And so right now at Patches, we have 9 kids, including Baby Q, who are scholarship patients. Those 9 kids are hugely costly. We have to have nurses for every 3 kids that we have at Patches. But kids are denied not on the basis of how ill they are denied on the basis, this is where we are with Medicaid. And it's causing huge, huge hardship for Patches. Kat and I are on the board. We do fundraisers. We've raised hundreds of thousands of dollars. Many community partners have got involved, but we would like to see this go away. And right now, Tallahassee is non-responsive. And it's really tough. And to your point, Martha, people don't understand that having a kid go to the ER for treatment that is not preventative treatment or it's just in the moment reactive treatment is far more expensive to the taxpayer than having a kid who's supervised by professional nurses and therapists every single day at a center like Patches. It's incredible. It's an incredible place. That's our story. So we need somebody who will fight for this organization. I know Jackson is the other non-profit that does have, but I don't think they provide education. Patches provides education because they believe the kids who graduate out into their care system. So the whole kit is choosing. Right now, Medicaid is very, very problematic. We are struggling.
And so these are our children, number one. These are the most vulnerable among us who we need to make sure that we take care of, right? As a society, that's what makes a good, healthy, strong society. Is how do we take care of those folks who are vulnerable, who need it the most, right? And so that should compel folks. But even then, as just the theme overall, it costs less. So isn't just a matter of the heart, it can be a matter of the brain too, of penny pinching, of making sure that we're using our dollars to maximum effect. They align on this issue, and that's what's incredible, and that's what's difficult also to understand why we have politicians, not leaders, politicians in Washington who refuse to just do what's best for folks and what's best for our wallets. And so you can tie it directly to the big ugly bill that the Congresswoman voted for, because those cuts to Medicare and Medicaid, I have the numbers right here, Medicare by $500 billion and Medicaid by $1 trillion. And these are costs that are going to go up for our seniors, for our veterans, for the most vulnerable among us, right? And that's what we got to keep our focus on, is on how can we get back to standing up for those folks, and because they don't have a voice, I don't think, in Washington, right? Because they don't have resources, they don't have the money, they don't have lobbyists to be able to pour tons of money into politicians' campaign coffers. And unfortunately in our system, that's what draws their attention. That's who their masters are, because of the fact that they care so much about holding on to their seats and their power, like the Congresswoman, that they've abandoned their principles and their integrity. So I think the best way is if you have someone who actually grew up working class like myself, somebody who sat at the kitchen table, who, my parents used government assistance for 1 year in order to get them on their feet. These are veterans, they had served the US Army, and they were working in factories and had job instability and really couldn't progress in this country. But with that, they were able to produce a working class life for my sister and me. They were able to own a home in Hialeah, Florida, off of my father's salary, a school teacher in the public school system, and my mom, a mail carrier. And that is way out of reach right now. People are delaying the purchasing of homes because they can't afford it. The rent is way too high. Their healthcare is way too high. It's really an assault on all fronts, and American families are the ones suffering, and we need to make sure that we have a representative on their side and not on the side of corporations and billionaires. Let me ask Damian Stevens, and I'll introduce you. You're Coral Gables resident and personal trainer. I know that you get your healthcare off the marketplace, off of the Affordable Care Act. Tell us about that, about what you're facing in terms of what you're already, spending on healthcare, and then what it will go up to if the current subsidies expire.
Yeah, Robin, thanks for having me. As everyone's aware, the squeezing of everybody's dollar has gotten to the point where it just won't squeeze anymore. And the middle class is impacted dramatically. I mean, we're just shrunk and pushed and squeezed down to, we're coming to a point now where there isn't going to be a middle class. We're going to be pushed out to the fringes. Now, I'm in an industry where I serve those who are not really impacted by it. They don't, we live in a very wealthy county, yet we have people like me. You mentioned the numbers earlier, where we're the biggest users of the ACA in this county. So Maria Salazar, I believe, is just focusing on her rich donors. She's not understanding that there are people like me, teachers, trainers, nurses, that are being squeezed so hard that we're not going to be able to afford. We can't afford rents. We can't afford car payments. We can't afford the rising car payment insurance. And this is just the last thing. It's kind of like the last straw, where it's like, okay, well, there's nothing left. You can't just keep robbing Peter to pay Paul. Now I was going through the marketplace for my insurance, and then 3 months ago when all the rumblings started, Trump's going to cancel it, Trump's going to cancel it. So what now? What now? And sure enough, I went online, and it doubled. It actually went up 2.2%. So I'm going to be paying this year just a little over $8,000 for my insurance. So I don't know how I'm going to do it. I'm already not traveling. Vacations go out the window. Buying yourself nice things, that's great. My dog just passed away So thinking about, you know, these are all the little things that pet care. So I'm thinking in my mind, well, am I gonna run out and get another dog? No, the vet bills are through the roof, so I'm not even gonna go out and get a dog. These are the things that you have to I start to consider. So it's just being squeezed from all around. This is just the final one.
Yeah.
And you're a healthy person.
And I'm a healthy person, which is interesting. The doctor was speaking earlier. He works in the emergency room, so I start to modify my own behaviors. I do a lot of woodworking. I'm also an artist, and I cut the tip of my thumb off 4 months ago. It was a pretty significant injury, and I stuck it in ice and I drove myself over to the emergency room. Now, if I can't afford, I'm going to try moving some things around. If I don't have health insurance, I'm going to start to modify my activities of what I do. Things like going out in a kayak. You know, am I going to go do an adventure race? You know, I do a lot of outdoor things. Do I want to use that saw? So I'm thinking about it. I don't want to get injured. And I'm also at that age, 55, where you're kind of coming into that window where these serious health things start to pop up in men. You know, you have to really stay on going to the doctor, getting all your tests done. And I do have some family history of things. They haven't popped up yet, but knock on wood.
Yeah. Look, if we get back,
That'll be a tough decision.
yeah, and that's, you know, the quality of life and the choices you have to make.
Yeah.
And people, you know, are also choosing insane things like feeding themselves and medication and drug, you know, with drug prices being through the roof and what they are. It's unfortunate. And what we really need, I think, is a public option to help drive down costs so that folks who do want to pay less for healthcare, who do want to buy in to a healthcare that maybe even, you know, a healthy person, a young person, who will be attracted to that sort of plan. And then the private insurance companies will have to compete with that. And that's more competition, that's capitalism, right? That's good, that's more choices for folks by having them have the ability to buy into a public option and keep their private insurance if they want it, but that's gonna help drive down costs overall. And so what this is doing is taking away people's choices. It's not only just your lack of choices in terms of healthcare, but just, again, your quality of life, the things that you want to do
That
in
you
your life.
enjoy doing.
Yeah, and,
exactly
you know,
right.
and that, you know, again, in the richest country in the world, and the best and the greatest country in the world, we can do better. And all we need are just leaders who are optimistic, who actually see, you know, ways to actually help the community, as opposed to always saying no. Always saying that costs too much, we can't do that. We're just gonna have to, you know, people are just gonna have to die. They're just gonna have to go without health care. That's unacceptable. We don't need to do that. It's a choice we're making. And
Or
it's
go bankrupt for whatever little money that you did put away. I'll use me as an example. Whatever. I'm at that point now where, you know, you're supposed to put X amount of, you know, if you're sticking to your budget, you're going by your retirement plan, you're supposed to invest so much in the market. Right now, I am just working to live.
Right.
Now, I'm gonna fall below that with this. You know, so I'm starting to go a little bit into debt. You start to cut off a little bit just so you get into even. So you just work to exist.
Yeah.
And that's really not a way to be living. Right.
So at this point, if there are maybe any questions, I'm sure we'd be happy to field them.
Can I have your full name?
Damian Stevens?
Damian Stevens. And so you're a personal trainer?
Yes.
Okay, so there's folks in our communities, I've heard from them, that aren't enrolled in this plan, and really speak to those folks, ones that don't have any loved ones in this plan, that think, not my problem, don't have to worry about it. What do you want those people to know?
Just because the problem is not affecting them does not mean the problem doesn't exist. And to simply turn your back on members of the community when they're going through hardship is, to me, it's inhumane. It really is. And I think that's coming from our leadership, you know, from the top down. It doesn't bother me, let them suffer. And where's the humanity? It really comes down to where has our humanity gone? I don't understand it.
And I would ask maybe the doctor and Martha to tell us, like, you know, and it sort of harkens back to what we were saying, but make the case for those folks that it does impact them.
Yeah, it does.
And I service those people, by the way. These are my clients. It doesn't affect them. But they understand, you know, my plight now, because, you know, I talk to them, but a lot of those folks, they don't understand, and they should understand.
But this is how it's going to affect them. Go ahead.
Right, and you mentioned, you know, that people think they're not affected if they're well-to-do, and it's not their problem, it's your problem. But their insurance rates will go up. You know, at some point, insurance companies are not gonna lose. You know, they're gonna make sure they gain. And so their rates will go up. And then, you know, maybe they're not worried about that, but they should be. And it's just, you know, most of all, it's not the right thing for human beings, for the, you know, richest country on earth to do this to our citizens. And, you know, every other country on earth, industrialized country, has healthcare for their citizens. And they do it because it's cost effective and it's the right thing to do. And people don't complain about paying taxes or, you know, you think of all the European countries that have healthcare for their citizens, have retirement for their citizens, to know that you don't have that stress in life, which I don't think Dave could probably talk better about it than I, but that cortisol that gets released when you're under stress, that causes more disease, you know, all those problems just feed into a sicker population, which is by far the most expensively and the most inhumane.
And it's also that we're building the world that we're gonna leave our kids and our grandkids. And even if you have good insurance, whether it's through your work or you're of an age to have Medicare, we're leaving this world to the next generation. And to leave them a world where you have to make, you know, a lot more money just to survive than the one that I received from my parents. You know, I mean, my dad served in World War II, worked his way from, you know, a farm in Illinois to a very successful life as a neurosurgeon, and was able to, you know, build a world that where you could succeed and expect that if you did everything right, you played by the rules, and your kids could have a world where they could do better than you did. And that's not what we're leaving our kids. If we make it to where you have to struggle to be across the line where you can get decent health care, and that's just not the way we should be leaving the place.
Yeah. And just to cap all of that, you know, the message is your premiums will go up, right? So again, if the heartstrings aren't being pulled, you know, let's be smart about it. You know, nobody wants their premiums to go up, and that's the way the system works. It will be spread to other folks if we don't, on the front end, you know, invest money that will be, in the end, more cost effective. Yeah. We have a question over there.
Yep. I'll ask a question, then we have time for maybe one more after that. Okay. And then, you know, any stand-up interviews that folks are interested in doing, we can follow up with that. My question is geared mostly toward Martha and toward Dave. As a nurse and as a doctor, the two of you occupy some of the most trusted positions of leadership and stewardship in our world. And yet, there's a disconnect between the work that you do and what you advocate for, including through your union, and the choices that elected officials are making. And you've spoken a little bit about, and Robin, you've spoken about people like Congresswoman Salazar being in the pocket of billionaire and corporate donors. My question for the two of you is, what does it take to get elected officials and people in positions of power to listen to the likes of yourselves, who are so trusted by people in the community?
Well, you know, I believe it starts with the leadership of Trump putting pressure on. I often ask, what the heck is he doing that they're so scared of him that they can't do the right thing for people? You know, what does he have hanging over their heads that they actually kowtow to him? It's very dysfunctional that an elected would get elected, and you know, this county it's unbelievable because we have the highest, as you said, number of enrollees, and all of our electeds are whatever you say, Trump, whatever you say, you know, and it's disgusting. So, I mean, I'm just 26 can't get here soon enough, and I hope we see a blue wave, and I hope that, you know, who would ever believe like Marjorie Taylor Greene would come to her senses a little bit, you know? I mean, you gotta hope people are gonna stand up. I mean, these, you know, whatever the trigger is with this Epstein stuff, and these people actually stood up to Trump once, right? I mean, maybe they'll get some more, you know, backbone, but, you know, I just can't wait for 26 and we can support workers. And, The problem in the South is there's so many anti-union rules. Only 10% of workers are in unions, which is where we usually collaborate together, vet candidates, and agree collectively to vote, which is powerful. You know, New York, Canada, you're talking 80% are in a union, and it gives us a lot better vehicle as working people to talk to each other and educate each other. And, you know, the South is very anti-union, goes back to the slavery days. You know, it's just anti-labor. But, you know, we hope and we can work, and this is our county, and we can take responsibility for this. You know, our commissioners in Miami-Dade are nonpartisan, half Dems, half Republicans, but stand up strong for Jackson. You know, and they know because they get elected in these districts by, you know, 200 votes, 400 votes. You know, it's very easy to make a difference. Unlike, you know, some of the bigger races, it takes thousands of votes to make a difference, and it just becomes more of a challenge for us. But I think, you know, we need to take the bad that's happening in DC now and use that as energy to really make a difference and walk and talk, and, you know, people like you standing up, thank God, because it's not easy to be a candidate. I mean, I think I saw something like violence has increased by like 9 times. I mean, it's disgusting. So yeah, but we love it when people stand up, and they, you know, are often telling people, why don't you run for office? And I totally understand why people don't, you know, because it's an ugly world.
Right.
But thank you for raising your hand and getting in there.
Of course.
And we need more of you.
Yeah.
Yeah, I mean, it's a little out of my field of expertise, but I agree. I think the way we start is by sending the right people to Washington and to Tallahassee, because the people that are represented, you know, the working class people who are having the hard time getting insurance, recognize that things aren't going well for them, and that you know, frankly, somebody's given them a bad deal. I think they have gotten a little deluded, a lot of people, about who's doing it to them. And maybe, hopefully, like Martha was alluding to, or starting to wake up to that fact, because it really is about having a voice in Washington, in Tallahassee, where our situations count. And, you know, unfortunately, it not only takes a lot of fortitude to be a candidate, it takes a ton of money. And that money is coming from people who maybe aren't looking out for the same interests as we are in our community. So I join Martha in applauding what you're doing, and thanking you very, very deeply and honestly for picking up this burden.
Thank you so much. I appreciate it, and I think, you know, we got to get back to listening to folks on the ground, experts, people who are seeing the devastating impacts day after day. You guys are the ones who know how much our community is suffering, and what we need to do to make sure that we're taking care of the folks. You know, our elderly who took care of us, our veterans who've taken care of us, our children who depend on us. These are the populations. These are the people that we need to think about and keep on our forefront. And as a representative, that will be my you know, sole focus. Is middle class, working class families, are those communities, veterans, seniors, children, who need our care the most, and not you know, corporations and billionaires. That is going to be my focus, and that's, I think, what we need in Washington. So I don't know if there's maybe time for another question, or
I mean, really last one, just for the
Yeah, let's do it.
doctor. I know that we have, you know, we're beginning to see lawmakers on both sides of the aisle rally around this issue. Ultimately, what's the final takeaway you have in terms of the folks that are trying to work in a bipartisan way? What's your message to lawmakers?
For the time being, the Affordable Care Act is the best we can do. I mean, it wasn't all that popular when it got passed, but we see so many patients now who have insurance through the ACA and are able to access care that they never would have before the ACA. I mean, you know, we were there when the day the change happened, and watching the kind of people who came to the ED at Jackson with real emergency questions, as opposed to looking for a substitute to primary care and comprehensive care that they couldn't have accessed. You know, yeah, there are a lot of problems with the ACA. It's not the most cost-effective, probably, way to deliver care. But we shouldn't let the perfect be the enemy of the good. And the good right now is getting people back the care that they're getting ready to lose.
Yeah, we can't take away people's Affordable Care Act. So many people, again, in this community depend on it. It's been a godsend for folks. And unfortunately, you know, we hear always about the Republican plan for healthcare. It's always 2 weeks coming, and this has been for 9 years now. And again, we hear the president talking about, well, there's a plan coming, right? They are still talking about repeal and replace. And, you know, the great late Senator John McCain was the one who saved the Affordable Care Act for millions of folks in this country and hundreds of thousands in this community of our neighbors. And so our message to the Congresswoman is grow a spine, fight for the Affordable Care Act, fight for the people in your community who are struggling, who need this. Let's not buy into this, you know, plan that is never coming, and certainly not buy into anything that would take away exactly what the doctor who sees it every day has been a godsend for folks and has actually helped people who before didn't have the care that they needed. So thank you so much, guys, for this discussion. I thought it was very great, very fruitful, very important, and hopefully it will get to our Congresswoman because we need change. So appreciate it.
Thank you.
Thank you.
Thank you.